can you tell us about this price disparity and the cost of a mammogram that the opposition brought up today?
Yeah, in terms of the specifics, I don't have a breakdown of what exactly the difference would be in the cost and why that is. I would suspect that some, for example, would be around for the mammograms and biopsies we do in Saskatchewan. Of course, those if there's any associated overhead costs, administration, everything that's affiliated with that would be built into the system already. I'd suspect. And so that would be one of the considerations, I think.
Do you have any concerns about this that the government would be taking advantage of right now?
No, I don't. I think, as I've highlighted before, this is meant to be a short-term measure to provide some additional options for people who are on the waiting list and are in urgent need of whether it's a biopsy or a diagnostic mammogram or an ultrasound. Again, when we looked at our options here, and again, this is one of several. We're looking, of course, the ultimate option or the ultimate solution we're looking for is to fill the vacancies we have that exist here, particularly in the city of Regina. That's the medium and longer term solution to get those filled. But in the meantime, we had asked, what other potential options could be out there on a very, very short term basis to help us alleviate the wait list.
How was the decision made? Was it public tender? Was it through connections? And where I'm going with this, obviously the concern related to how disconcerting it might be that there was political involvement. So can you clarify any way, shape, or form how the decision was actually made?
Yeah, Marie, as far as I know, again, when I asked our officials about it, I said, can we see what's possible? Because I knew that other provinces were doing this already. For example, BC is sending people out of province. And I was aware of that from some media stories earlier this year, so I asked a similar question of our officials, just to say what might be available to us. And this was one that was identified because this company currently already has a contract with the government to do hips and knee surgeries.
And so that was the basis in relation to the decision-making gut, because they were doing hips and knees. This was they could do mammogram.
Yeah, my understanding is as our officials reached out, it was determined that this company could also help us in this space and provided us with that option. And the officials have had those conversations to see if that would in fact help us in this particular space, and that was identified that it would.
Do you think it should have gone to tender, or could it have gone to tender under the circumstances? Because sometimes with the time frame.
Yeah, it's a good question, Murray. I guess I would say this was the one that was identified to us immediately. And we were looking looking for the shortest term solutions we can, again, to really cut down, because there is a lot of pressure on the wait list. So in hindsight, should we have, perhaps, but again, I think this was the one that was first identified to us and was identified as being a fit for us to be able to implement this very, very quickly, and that's why the decision was made.
Did the political donation aspect of the parent company come up in cabinet discussion because
No, I wasn't aware of it. It was never discussed. No.
Is it problematic for you? Because not very many companies can do this, I assume. So you're going to run into these conflicts when you don't have options and these people decide.
Yeah, I could see that being a potential issue, right? Because you're right, there aren't a lot of companies out there or organizations, whether they're public or private, that can conduct this service, and that's why, again, that's part of the reason. Yes, we have radiologists in Saskatchewan, just as an example, but we don't have the numbers that we need that specialize in this particular area. So that I'd agree that this, just because of how specialized this is, limits the options that we have.
Did the province look at other private operators when making this decision?
I don't know if there were other ones that were contacted. I'd have to speak to the officials about that. But again, I think this was the one that was immediately identified to us as being a short-term solution that could turn around fairly quickly by amending the existing contract we had.
And I think you said the Northwest Territories uses this exact same.
Correct. Yeah, that's my understanding. Yeah.
How much are they paying?
I don't know.
Because it just might. We just want to make sure the province is getting a fair shake.
We can check. I'll have our officials checking to see what that dollar amount is.
Okay. And Mr. Doherty, he's lobbied the government on behalf of this company. Did his lobbying influence the government at all in this decision?
No.
Once again, it's issues of perception.
Yeah.
You're not the political minister. You don't really have a political minister, but what kind of problems that create?
In terms of the perception?
Yeah.
Yeah, Marie, I can see that. Again, there, just to your earlier point, that there aren't a lot of, not that I'm aware of anyways, not a lot of companies or operators in this particular space. And again, as as I said before, cancer is a very sensitive topic. It very much is, and as I think each and every one of us can probably, knows somebody very close to us or fairly close to us that has experienced cancer. And I met with a number of patients, and I do regularly, but particularly this fall, on this issue of the wait times for breast cancer screenings and diagnostics and biopsies. Met with a number of people who were, and as they met with me and sat across the table from me, were asking for solutions now. What can you do today? And understanding that that we are trying to fill the vacancies for specialized breast radiologists, but they were looking for immediate solutions, and as we're
How much did Mr. Doherty's role have to do with finding a solution?
nothing in this one.
I think there's a facility in Ontario. I think they're offering, I think it's like a couple $100 or up to $400.
I've heard that, yeah.
So it seems a lot cheaper.
Yeah.
Than just $2,000.
It's also a lot further away too. Again, I think for a number of patients here, as we looked at, in terms of how quickly could we turn this around. Again, I don't think, and I don't know the name of that particular facility, but I assume that we don't have a contract with that particular one, whereas Clearpoint in Calgary did or already do for hips and knees. And again, I think in the sake of expediency and also for closeness, I think for Swift Current example, Swift Current to Regina, 5 to 7 hours approximately for a drive. Not saying that that's a short drive by any stretch of the imagination, but again, one of the closest options that was made available to us.
How does this affect the province's surgical backlog? Because you're using this facility for surgeries as well.
It's my understanding it doesn't impact the number of hip and knee surgeries that are being done there. When our officials were in contact with this company, they indicated to us they had capacity to do this. And again, it's my understanding that it doesn't impact the hip and knee surgeries that are done there. I think that's probably in a separate stream.
Given this kind of question of perception that's been raised today, would the ministry continue to use this particular clinic in the future if it comes up that we need, some out-of-province capacity in this way?
Well, I don't think, when we announced this last week, and as we had the option presented to us, when I asked to say, what can we all potentially do in this space? This is not meant to be a long-term solution. It just isn't. The long-term solution is that we are appropriately staffed and fully functioning here in Regina at the breast assessment clinic, and the same thing in Saskatoon. Again, this is a short-term solution, a contract in place to purchase 1,000 of these until the end of March of 2025.
I guess I'm asking, maybe not hindsight, but future sight. If it does come to a place where you need to contract with a province contractor, would you choose Clearwater again because you do have existing contracts, or would you tender?
No, I think we would probably look at all options that are out there to make that decision. Yeah.
You know more options now? Like,
What's that?
Are you more aware of other options now? Just kind of what everyone else is.
I'm not, other than from what I've read, as Jeremy pointed out, potentially a company in Ontario that could do this. I think that our officials are probably would always be looking to see what else might be out there. Again, should we need it? But I think at this stage and at this point, we're satisfied with the contract we have, and again, hopeful, because the waiting list that we have is roughly 350 women, a significant portion of those from Regina and southern Saskatchewan, but we're hopeful that this short-term contract will address that waiting list and that we get the other positions filled so the rest of our system is working appropriately.
When Clearpoint was initially selected for surgeries, did it go through a public tender process then?
I don't know. I'd have to check. That's part of my time as Minister of Health, but I'd have to double check that, Jeremy. I think so, but I honestly don't know the answer to that.
Okay.
Yeah.
Thanks, everybody.
Okay. Thank you. Thanks.